Hello, good afternoon, everybody. My name is Ricardo Ramirez. I am currently a respiratory therapist working for a hospital, and today we will be talking about for leadership responsibility. So, before we start, I would like to give a little bit of an introduction. So, healthcare administrators should be capable of managing a team or even an entire organization. This is so important. Why is this important? This is important because we should be able to communicate with our peers, with our colleagues, with our subordinates. This is important because it will improve day-to-day operations, and in the end, it will also help healthcare providers provide safe patient care. So, as I mentioned before, pretty much they're also in charge of organizations' day-to-day operations, and they also help motivate their teams to achieve their goals, their objectives. It could be team objectives, and it could also even be personal objectives as well. Health administrators are responsible for ensuring that their organizations are practicing medicine in accordance to healthcare laws and ethical standards. This is so important. Why? Because that's why there's a such thing as regulatory agencies that set standards for healthcare organizations for them to follow. And as a healthcare administrator, is important. The healthcare organization that we work for, they adhere to these standards. The standards that have been set. All right, so let's just continue with the next slide. So the roles of a healthcare administrator, it's the primary responsibility for a healthcare administrator is to keep patient information safe and secure. To do so, a healthcare administrator must fully understand the privacy and security law. Additionally, educate employees on the risks and benefits of social media. This is so important, right? And why are we transitioning from standards and like laws and ethical views to patient safety? Because it's important for a healthcare provider to have these conversations with their colleagues, with their peers. Being able to protect patient information, it's so important, because if we don't do so, we might be violating laws like the HIPAA law, right? So this is why it's important that the information that is being shared, it's always secured, and we have to make sure that we're always only sharing it to whoever the patient allows us to share that information with. Also, a healthcare administrator should assist the organization in establishing patient safety and ethical principles that guide decision making in order to avoid medical errors, accidental death, and malpractice. This is important. Why is it important? Because healthcare administrator's job is not only to protect patients, but it's to make sure that providers that they work with make ethical decisions that will benefit the patient, right? And this is important because we'll discuss this furthermore into the presentation, but we will talk about a case study a little bit that we work on and during this course. But this is really, really important, right? And if you don't have the tools to do so as a healthcare administrator, do some research, talk with stakeholders within the organization, and try to get those tools so you can educate your staff, so you can better your staff so they are less likely to commit any mistakes that can cause some of this, right? Like medical errors, like accidental death or malpractice. When it comes to making sound decisions regarding legal and ethical standards, every healthcare administrator is held to an extremely high standard. This is so important. For instance, I used to work for an organization. I will not name the organization at the time, but their mission was, or their slogan was, "Excellence is just the beginning." So this is true, right? This is true because holding an organization to really high standards allows providers to have that mentality, right? To have that mentality and to always remember that safe patient care, it's so important, right? Also, administrators that are able to identify and follow an organization's vision and mission demonstrate their value, and they could that they could held to any standard. This is so true and so important at the same time. I'm sorry about that. We're just going to continue to legal and ethical foundations in healthcare. Healthcare practitioners currently battle with issues like short staffing, high patient influx, medication shortage, high levels of stress. Due to these issues, practitioners are more likely to make simple mistakes, and this is 100% truth. I actually battle with this day by day. I mean, I could tell you multiple stories For instance, we extubated a patient, and then this patient ended up having stridor. Stridor is pretty much inflammation in the upper airway, and the way for us to treat that is to provide a medication called racemic epinephrine. And what this medication does is decreases inflammation, and it allows pretty much no, it doesn't decrease inflammation. It allows air to go in and out the lungs with ease, pretty much, because of the inflammation problem that we have in the upper airway, right? And what was the problem that we were having? The medication was not in the Pyxis. The Pyxis is where we retrieve medications. It was not there. So we ended up having a meeting about how we could have improved that scenario, and they ended up contacting the pharmacy staff so they could pretty much load that medication in the Pyxis, and for the future, if we needed that medication, it was there. We didn't have to wait for a pharmacy to tube it. You know what I mean? These are emergency situations, and there are certain medications we need to have. And racemic epinephrine is one of them, right? And then another one would be, the fact that the medication shortage, right? Currently, there's a medication shortage that has been going on since last year with a medication called albuterol. This medication is a bronchodilator. It's a medication highly used for patients that have asthma, COPD, right? It's a medication that helps with bronchodilation, so patients that come in into the hospital wheezing. So the main company that produces this medication has closed down. It's closed down due to economical problems, due to recession, and they stopped producing the medication. So now there is a medication shortage, right? There's an increase in demand and decrease in supply. And by that happening, meaning, patients come into the ER with the symptoms, and sometimes we can provide them that medication. Of course, there's alternative medications like levobutyl, for instance, but this medication is expensive, right? So those are the little details and things that we have to work. But at the same time, there's other routes, right? We can also teach patients how to use a meter dose inhaler, stuff like that, right? There's always option, but at the same time, those little things that healthcare providers battle with on a daily basis, they affect workflow. They really do. The job of a healthcare leader or manager is to train bedside practitioners, to practice medicine under the law and make ethical decisions based on what is right for the patient. This is true. You always have to do what's right for the patient, and at the same time, you always have to make sure that you're following the policies and procedures that your organization has set. And believe me, when you do that, you allow yourself to practice safe medicine, and this is really, really, really important. Healthcare leaders should go above and beyond in training staff on simple laws like HIPAA and the Stark Law. This is true. Like I mentioned before, the HIPAA law. Make sure that providers know the HIPAA privacy and security law. You know what I mean? Make sure they don't breach none of those laws. This is really important that we teach staff these laws so we can prevent any lawsuits that might happen, And then definitions of law and examples. So law, according to the Merriam-Webster, law is defined as a rule or of behavior and action stipulated or officially recognized as binding or enforced by a controlling authority. And then some examples of healthcare laws can be HIPAA and the Stark Law. HIPAA is the Health Insurance Portability and Accountability Act that was established in 1996. That was in charge of protecting patient privacy and medical records. So why are we protecting them? Because sometimes we might want to use patient information as a case study, but we have to make sure that we don't provide little details or provide pictures that might have something that could reference a patient. And if we were to do that, make sure that we, blur out their name or black out their name or, cover their date of birth or their insurance, stuff like that. This is really important because if we don't do that, we're going to be bridging this law. So, or breaking the law pretty much. The Stark Law, also known as the physician self-referral. This law prevents that physician from making referral to a family member or entities he might be acquainted with or might have ownership. So this is pretty much has to do when physicians are trying to get money. So they're trying to get money. It could be from Medicare or Medicaid. And what they do is that, they refer somebody like a family member so they could get paid for the care that they have provided pretty much, and not really provided, but pretending they provided so they could get money, so they could get paid, and then they're violating this law called the Stark law. And as a healthcare administrator, it's important that we educate our staff, but we let them know what's ethical to do, and they don't make these mistakes that could penalize the organization, and not only that, but also affect the patients that come and visit the hospital due to issues like this. Definition of ethics. Ethics is based on well-founded moral standards that instruct healthcare practitioners on what they're supposed to do when taking care of a patient. Usually this involves respecting patient rights, obligation, social benefits, equality, and specific virtues. So ethics is pretty much doing what's right for the patient. You know what I mean? Doing what would help the patient acquire the best result. And at the same time, making sure that the decisions that you're making, either it could be individually, it could be as a team, it could be during rounds, are also communicated to the patient, right? Make sure you let them know step by step what's going on, so they have an idea what's happening with them, why are they getting treated that way, and what to expect. Those three things are really important. For a healthcare practitioner, it's important to adhere to a code of ethics that has been established in the workplace. And this is also true. Every workplace has ethics, right? Or has visions, or have missions, or something like that they follow. So with that being said, adhering to a code of ethics would allow providers to practice safe medicine. It would allow them to practice safe medicine, and at the same time make good decisions when taking care of patients that are really sick. And then at the same time, there's organization that they're like all organizations that they're overlooking the work that healthcare organizations does. So these organizations are regulatory agencies. Regulatory agencies are in charge of regulating compliance of healthcare systems and organizations across the United States. There's three main levels that ensure guidelines and regulations are followed. And then this could be federal, this could be state, and then this could also be it could be local health departments, right? So we're going to talk a little bit about the federal ones. So the federal ones, an example would be the United States Department of Health and Human Services, the HHS. So for instance, what is their job, right? For instance, they work above the FDA, and the FDA is the agency within the HHS that allows for food, for drugs, and for stuff that we eat to be approved, and just to make sure that whatever we're getting into our body is not going to cause any harm. So regulatory agencies continue. So pretty much the second level is going to be state health departments. So for instance, I live in the state of Illinois, and that will be the IDPH. So IDPH is just like every other agency. They have a vision, they have a mission. And then, for instance, their mission is to advocate for people in Illinois to reimagine health policy, promote health equity, prevent and treat disease and injury, and prepare for health emergencies. So they are trying to be proactive and prevent things that could happen in the future, right? So yes, they might come into your organization to do either every 6 months or every year to assess how the hospital is running, and they might find little mistakes here and there, and then it comes what is so-called, oh, we got dinged for this, dinged for that. But these are ways, or what I call areas of improvement for an organization to work on to provide safe patient care, pretty much. And then the third level is the local health departments. This varies based on the county, on the city people live, and at the same time, they should adhere to state guidelines. For instance, like the CDC. So this presentation discussed the FDA, the CMS, and the Joint Commission. So The FDA is in charge of ensuring that safety, efficacy, and veterinary drugs, biological products, medical devices, our nation's food supply, cosmetics, and radiation emitting products. So I ensure that all of this service that people are receiving, like medication, food, biological products, are safe, and whatever we are consuming is not affecting in any way, shape, or form our body. At the same time, the healthcare administrator role is to advocate for patients and help them make healthy food choices. So this is the job that not necessarily a healthcare administrator does, but at the same time, one of his peers, or it could be one of his like subordinates. For instance, it could be a nutritionist, involved into a patient like food and dietary like decision, so meaning educating patients on like good food selections. For instance, somebody that have high blood pressure, right? Make sure you educate them on like not consuming so many like salty products, not so many products high on cholesterol. So stuff like that will help patients. You know what I mean? By educating patients, will help patients make like appropriate food choices according to their health. And then we're going to talk about the Centers for Medicare and Medicaid Services. The CMS works towards improving quality outcomes, safety, equity, and accessibility for all individuals, particularly those in historically underserved and underreserved communities. As a healthcare administrator, it is important to understand how CMS works because they provide insurance coverage to millions and millions of patients through Medicare and Medicaid. Furthermore, improve patient care, strive to high quality patient care. It is so important to understand how much coverage they have and find solutions if they cannot receive any coverage. So this happens on a daily basis, right? Like patients coming into the hospital with no insurance. Patients coming into the hospital with insurance that provide minimal coverage, right? And then of course, we have adult protective services that also work with healthcare administrators. They work with case managers, they work with social workers, and try to find a way to find this patient an insurance provider, or so some type of like payment plan or coverage, so they can get healthcare, because they need healthcare immediately, right? They're not gonna, if they're going through a medical emergency, they're not gonna ask you, oh, what's your insurance? If you're going through a medical emergency, they're trying to stabilize the patient first, and then we can figure out everything else later, right? We're trying to save that patient's life. And this is the people that work together as a team to try to aid these patients get insurance, and try to find some coverage, and somebody could pay for the services that they're receiving. The Joint Commission. And then the Joint Commission evaluates healthcare organizations on a regular basis and encourages healthcare providers to excel in providing safe and high-quality patient care. Furthermore, they're accountable for evaluating and creating over 22,000 healthcare organizations. And then a healthcare administrator's job is to make sure policies and procedures from the organization he works for aligns with the standards set by the Joint Commission. This is important, right? It's important because we're trying to make sure that whenever we are being audited by Joint Commission, we're not violating any of these policies and procedure, right? So this is really, really vital. And then at the same time, we talked earlier about HIPAA, right? And we're going to transition a little bit into social media, right? Social media has increased throughout the last like 15 years. Now, we have a bunch of cell phone devices, we have computers, we have iPads. We have a bunch of ways where like people could access social media. And then, we have these websites, or we have these pages, right? Like we have Facebook, we have Twitter, we have YouTube, we have TikTok, all this social media that can pretty much have a negative impact on a patient and also on a healthcare provider. And it's important that as a healthcare provider, we know how to utilize this tool. And the way that we utilize it properly is, we communicate with either, it could be with our colleagues, or it could be with our patients in the safest way possible without leaking any patient information, right? So it's important to understand the improper use of social media can have a negative effect towards the patient and towards us, towards the provider, Some examples would be when patients look up treatments and diagnosis of possible disease. In scenarios like this, it's important, that we direct patients, and if they're going to be looking into like a little bit of like disease management, possible treatment, expectations, that we guide them in the right path. And the right path for this will be make sure that they're looking into peer-reviewed information and make sure that the peer-reviewed information that they're gathering, it's from a reliable website. You make sure you're not grabbing this information from Wikipedia. Make sure that if you're going to be acquiring some of this information, it's from reliable websites, right? And then at the same time, adhering to confidentiality and HIPAA. To adhere to HIPAA laws, a healthcare provider should handle patient information with confidentiality, right? Confidentiality is the process of keeping information private and not disclosing it to people who are not authorized, pretty much what I mentioned before. Any information breach without consent will break HIPAA laws and secure providers some high fines, license removal, and possible jail time. This is so important. This is why social media shouldn't be used for trying to promote what happened, with the patient's case or something like that. And if you're going to do that and it's going to be a teaching moment, make sure you don't provide a lot of details about the patient, because this could cause you your license as a practitioner. HIPAA privacy and security laws. We kind of like touched on it at the beginning, but now we're going to define a little bit about them. So the HIPAA privacy rule is a set of federal standards that protect the confidentiality of patients' medical records and other health information maintained by covered entities. The HIPAA security rule defines a nationwide set of security standards for protecting patient information stored or transmitted electronically. Examples include electronic medical record, electronic health record, patient health records, I typed patient health record twice. So, and then a healthcare administrator job is to be well informed in the security rule standards so the organization doesn't prevent breach of any of them. So those standards are physical, administrative, technical, policies, and procedures to prevent this from happening, correct? Excuse me. Patient safety and ethical principles. Safe patient care should be every healthcare organization goal. But sometimes it's not easy to accomplish. Considering what we mentioned before, providing safe patient care has multiple variables, right? You need to make sure that the provider that is taking care of that patient is well taken care of, right? We have to have the appropriate resources. We got to be able to have access to medication and access to safe staffing. And as a healthcare provider, I can tell you that is a constant struggle. And I am sure that it will never go away. Why? Because the generational gap that is occurring at this time is real, right? We have a lot of people retiring. And, for instance, I'm going to use myself as an example. I am a 30-year-old practitioner, right? And the people that I practice with, there's a 25-year-old age gap. So by that time, we don't have any practitioners between that age or that age range. People are deciding to retire and we don't have enough staff. That's one of the issues, right? Excuse me. Another issue could be that we have a problem of hiring. There's multiple people that, they go through school, they go through like nursing school, they go to like, pre-med, they become doctors, and then they're like, oh yeah, I'm not doing this anymore, I'm going to change careers. And then they switch careers and they decide to no longer practice because they realize the high levels of stress that healthcare providers go through, and then they're like, this is not sane for me, and I'm just gonna transition into a different career. And it happened to one of my colleagues, right? I had a nurse that I work with. She was a nurse for 5 years. She worked through COVID, and she said, I'm not gonna do this anymore, and she's now going to law school. So it can happen to the best of us, honestly. So healthcare administrators that strive for safe patient care, This should ensure that organizations have safety policies, procedures to prevent any medical errors. This also helps healthcare providers, right? People that do bedside care, because when you have policies and procedures already set, and when you make sure that you train these individuals, their mentality is already, oh, I gotta make sure I'm not violating any policies and procedure, and then I gotta make sure that I'm doing what's right for the patient. And as a healthcare provider, we gotta make sure these policies and procedures are up to date, right? Make sure that we're practicing medicine that is, evidence-based practice medicine that is up to date, and we're doing, the best course of action for the patient that will benefit him the most, instead of practicing some medicine or some procedure that used to be done 20, 30 years ago. We gotta be, pretty much what I say, we have to be on our toes. So patient safety is always important in emergency and an emergency situation. Every healthcare provider should always practice medicine with transparency and strong ethical beliefs. A practitioner that has both of these skills under their belt will advocate for patients to the best of their abilities. This is so true, right? And then we can put, for instance, if you had the opportunity to watch that movie, The Good Nurse, on Netflix, right? What she was doing, it was, what's best for the patients, right? She realized what her colleague was doing, that he was making a big mistake, or he was committing a felony, and he was technically committing murder, and she advocated for those patients and their families because they wanted to find who did it and why they did it, and a practitioner that has ethical beliefs and somebody that advocates for their patients, she's a great example of that, right? Because she cared about people she didn't knew, and that is somebody with strong ethical beliefs. So medical errors, accidents, accidental death, and malpractice. So these are things that currently happen in healthcare. It could happen because providers are in a rush. It could happen because providers, there's not safe staffing. It could also happen because there might be physicians that are deciding to not listen to their peers or their colleagues' suggestions on how to treat a patient, and they decide to do things their way. And that's a problem sometimes, but we'll get there. So to prevent medical malpractice or negligence, it is important for healthcare providers to have good patient assessment skills and solid decision making. So how do you acquire patient assessment skills, right? If you think about that as a healthcare provider, what can you do for your team, or what can you do for your colleagues, right? Having committees that are like education committee, patient safety committee. These committees will help providers acquire knowledge, while they're in the job, in things on like patient assessment that will help them excel at their work, and furthermore, this will help them make appropriate, decisions in healthcare for a patient. Medical errors can occur due to negligence in diagnosis, treatment, and patient management. Medical errors can be fatal and even cause death. This is 100% truth, right? Like, for instance, providing a medication that, providing the wrong medication, providing the wrong dosage of a medication, right? Those things happen, and, this is why you have to pay close attention. And now this is, a lot of people complain about the electronic, medical records and, scanning the patient, scanning the medication. But this is a great way to have, close control of what you're providing to the patient. Because once you scan that patient, automatically you go into the patient's chart. So you know that you have the right patient, right? But the question to that provider is, does he know that he has the right medication? The only way, that he will find out is by scanning that medication. So he scans the medication and he realizes, oh wait, this is not the right dosage. So he goes back and switches and grabs the appropriate dosage for that patient. So, the electronic medical record, or the EMR, Epic, has come in like real handy to make sure that we are not making medical errors like that one, like example I just provided you. For instance, the case study, the importance of reliable information exchange in emergency practices, a misunderstanding that was uncovered before it was too late. This case study alludes that appropriate decision making of healthcare providers change a patient's outcomes and kept him alive. This is 100% truth, right? So this patient, this case study doesn't go a lot into detail, so I'm gonna be really suggestive at this point. But what I'm guessing is that this patient had cancer, right? And he had already overcome that stage in his life. He was treated. He probably went through like chemo or radiation, and then he went through all that stage and he survived. But the problem is that, when he went through chemo and radiation, he probably struggled a lot. And, physicians probably had a conversation with his or her family, and they talked about DNR, which is do not resuscitate. So the do not resuscitate clause states that you shouldn't provide any chest compressions if that is the patient's wishes, right? So according to the case study, it says that this DNR clause was on his chart for a while. It's been there for a couple of years, but at the time that this patient was admitted into this facility, that DNR clause was from like years ago. So as a healthcare provider or health administrator, we have to have these talks with patients. We have to, after they get admitted into a new facility, we have to ask them, if your heart were to stop, would you like us to provide chest compressions, or would you like us to bring you back to life? Have this little talks, you know what I mean? This is important because at the same time, we will be advocating for the patient and we will be respecting his or her wishes, right? This is so important, right? If you read furthermore in this case, you will find out that the patient ended up, living and he was perfectly fine. But what would happen, if you paint the other case scenario, right? There's a little thing that I didn't mention in this case, but I'm so sorry. So EMS, when they arrived, they decided to ask what's going on with the patient. His heart stopped, and after all of that, the paramedics decided that they're like, there's a DNR clause. We're just gonna be on the safe side. We're still gonna do compressions for this patient. And this is where good patient assessment skills will show you, or will show that you advocate for patients. Will show that you will go above and beyond, and that that this patient is not on that stage anymore. We could save him. You know what I mean? So this is what I'm saying. Having good patient assessment skills could save patients' lives. And also, effective communication in medical emergencies can show the difference between life and death. This is so true. And why effective communication or closed loop communication? Because when you talk to somebody, make sure, right? For example, let's put, for instance, when you're running a code, right? What happens when you're running a code? Let's say you're the lead doctor, right? You have to make sure that there's somebody on the chest. There's somebody doing compressions. You have to make sure that there's somebody pushing meds. You have to make sure that somebody is bagging the patient. You have to make sure that there's somebody checking for a pulse. You have to make sure that somebody's checking for time. Why do you have to be in charge of all of this stuff? You have to be in charge of all of this stuff, and as a leader, right? And then if I am telling you push 1 milligram of epinephrine, there has to be closed loop communication, because you have to tell me again, so you want me to push 1 milligram of epi, and then pushing, and then make sure that when you're pushing that medication, you say out loud, I'm pushing this, you know what I mean? And then when you're checking for a pulse check, and then no pulse, resume compressions. And then as a leader, if I'm running a code, I can say, okay, resume compressions, make sure that I'm in charge of those little things, because those little actions could save a patient's life. All right, now we will transition into legal and ethical standards. And then I just want to say that every healthcare organization possesses legal and ethical standards that should be held to. And then some of these organizations decide to put their standards into effect within their vision and mission. So pretty much what we talked to in the past about the example of the previous organization that I mentioned that I used to work for. And they do this so they could hold employees accountable for their actions in the workplace. Pretty much what I mentioned in the past. So furthermore, they attempt to teach employees to always practice safe patient care and improve overall quality of healthcare. This is so important, right? Why do you want to improve overall quality of healthcare? Because you want to be the example. You want to be the organization that sets the way, meaning, oh man, look at what this organization is doing. They're saving more lives. But this or that procedure, we should probably ask them, get in touch with them and ask them what they're doing. And by doing that, you're showing that you are attempting to improve overall quality of healthcare and that you care about your patients and you also care about your organization, because you're trying to make sure that, that patient, they're like, oh wait, we offer that service too. We can take care of you here as well. Think about that. This is a way to advocate for patients and improve patient satisfaction by following legal and ethical standards set by federal and state agencies. And then now we will transition a little bit into the labor laws, and we're going to transition into this because we have to understand that patients and providers, they have rights, right? And there's laws that, cover providers, and then there's laws that covers patients as well, right? So the mission of the U.S. Department of Labor is to foster, promote, and develop the welfare of American workers, job seekers, and retirees, to improve working conditions, to advance opportunities for profitable employment, and to ensure work-related benefits and rights. Healthcare administrators should be aware of the laws set by the Department of Labor and prevent any misunderstanding that can possibly cause any lawsuits against them or the organization. So some example of the laws set by them are the Fair Labor Act, Age Discrimination and Employment Act, Americans with Disability Act, Pregnancy Discrimination, Immigration and Nationality Act, Rehabilitation Act. So all of these laws, it's, just ways to trying to advocate for healthcare workers, right? Make sure nobody gets discriminated just because they have a disability, just because they're pregnant, just because their race, their gender. You want equality in jobs, and this is important, right? Because having a diverse work environment, it's actually better for any organization. If you do some research and look this up, you'll find that, the diverse work environment is just ideal because people are able to communicate even better. And then in conclusion, right, healthcare administrators should have a well-rounded knowledge of the day-to-day operations of an healthcare organization. This allows them to have a smooth workflow and improve communication with their peers and subordinates. Healthcare administrators should always possess knowledge in their patient safety policies and procedures, HIPAA laws, regulatory agencies, ethical and legal standards. Pretty much what we talked about before. Being able to identify areas to improve within the organization allows them to improve overall patient care and thus patient safety, which patient safety is one of the most important things, right? Providing safe patient care should be a priority. Furthermore, promoting safe staffing also benefits patient care. Cause and effect. Finally, a healthcare administrator should not only advocate for their organizations, they should also advocate for patients. It's important to note that without patients, there cannot be an organization. These are some of my reference, and I just wanted to say thank you very much for your time. Have a good day.